This is our welcome screen. We love to share about our intentions behind the learning collaboratives. We would love to have an engaging audience today. Feel free to ask questions. The presenters will each pause for questions at the end of the presentation. And we would love to have you introduce yourself and your organization in the chat if you haven't had a chance to do so just yet. But we're going to keep rolling and just talk about the topic for today. So today's topic is the growing role of the community health worker. And this is a topic that is near and dear to our hearts here at Greater Health Now. We work with many community health workers throughout our 9-county region and support them in as best we can in many different ways. So we are really truly grateful for all of the community health workers that we work with or community-based workers more broadly, and are excited to talk today about sort of what's going on in the field of community health workers. We have some wonderful presenters lined up. The learning outcomes for today, I will just go ahead and read through them so you have a sense of what you'll be walking away with. So first, you'll be able to describe how current data trends illuminate the growing role of the CHW. And then you'll gain insight into the structure of the CHW benefit. You'll learn how the Washington Administrative Code defines CHW services, provider qualifications, and scope of practice, and then get an overview of the approved billing codes and rates. Next, you'll be able to describe current activities of the Department of Health CHW Leadership Council. And finally, you'll be able to identify themes among the experiences of current CHWs. So we have a wonderful lineup of presenters today. First, we'll hear from Aisha Sulich from the Washington Employment Security Department, and then from Nikki Banks from the Washington State Healthcare Authority, and then Joaquin Vidrio Ruiz from the Washington State Department of Health CHW Leadership Council. And finally, we'll finish up with a panel of some current CHWs. You'll hear from Fatima Andraka, Shelley Slaybaugh, and Jen Pimentel. So with that, I'm excited to welcome our first presenter, Aisha Sulich. Aisha Sulich is Employment Security Department's regional labor economist with 14 years of experience in labor market and economic analysis at the regional, state, and national levels. Aisha specializes in data dissemination, research, and analysis by showcasing the importance of quality economic data and labor market information tools for everyday use by businesses and the population at large. Currently serving as a local economic expert with multiple organizations across Eastern Washington, Aisha graduated from Boise State University and worked for Idaho Department of Labor and Idaho Neurological Institute before moving to Washington State. So with that, I will turn it over to you, Aisha.
Good morning.
Good morning.
Thank you so much for having me here this morning. Hopefully, I'm going to give you some insights on statistics for community healthcare workers. As regional labor economist, part of my job is to give you statistics so you can make right decisions and guide you to right appropriate data sources and information that's associated to what you need to make those decisions based on. So with that, I'm going to share my slides. All right. Minimize this. I did this, 100 times, and it's just, again, something different. All right. So today I was asked by Danny, thank you, Danny, to give you some insight on statistics and trends on community health workers in the state and the region we are serving under Greater Health Now. As of most recent data information published in May 2024. We have estimates from 2023. We have a lot of information that defines community healthcare workers. And with community healthcare workers being in many different industries, the main role of community healthcare workers is to promote health within communities by assessing individuals to adopt healthy behaviors so they can be healthy and utilize actually healthcare services at a lesser rate. With these rates, eliminates continuous or excessive usage of, the urgent care or emergency care services that could be prevented through, better healthy behaviors and adapted through for many of these individuals. Also, community healthcare workers serve as an advocate for many healthcare needs of individuals by assisting community residents and effectively communicating with healthcare providers and social service agencies. All the needed or a bridge needed between these services and needs that are being combined. So basically, community health workers are mediators between service providers and those who need those services. Acting as liaisons, advocates, or implement programs that promote, maintain, and improve individual and overall community health. So they take a big role in that dissemination of services, information to local communities and individuals that need that, and community to be aware of those services, and services to be aware of the needs within communities as well. Also, these community health workers can deliver health-related relative services like, um, blood pressure, glaucoma, hearing screenings, and many other aspects of not technical, but certifiable offerings from that aspect. So they have many different roles within many communities. But then when we look at different titles for community health care workers, it's very diverse. Community health workers can be behavioral health advocates, community liaisons, community navigators, peer navigators, promoters, public health outreach workers, community health program coordinators, health navigators, health advocates, guest advocates, contact tracers, HIV, CTS specialists, community health promoters. I mean, just name it. There's many different titles for the community health workers in the communities. And we want to make sure that when these titles are out there, that you as individual or community at large can associate that directly to community health workers title and job duties. Many different duties are within this community health workers SOC code 211094. And with that said, there's many different requirements for this occupation to do. Most of the time, requirements for community healthcare workers will start with high school diploma, maybe bachelor's degree, or some college attainment, certificate programs, on-the-job trainings, specialized technical trainings, and certifications, and it goes on and on. But the task, duties, and responsibilities never change. So whatever educational attainment or certificate program or you achieve, the requirements for that job actually don't change. So depending on where you land on industry as community health worker, and many different industries have different wage structures for a community health worker jobs and roles. But overall, in the state of Washington was estimated from projections department in labor market division that we had over 3,600 individuals. On average, wage for community health worker was about $27.52 per hour which is about $57,000 a year. When I looked at 9-county region for community health, Greater Health Now, there was over 250 estimated individuals working in this job. And take a note that these estimates are detailed to this specific occupation, and they actually do not sum up because of the totals that sometimes include occupation not shown separately within these estimates. And also, these estimates don't include anybody who's self-employed and working under this occupation. Also, annual wages have been calculated based on multiplying the corresponding hourly wages by 2,080 hours worked a year. And there's certain or relative standard errors. And as you can see here, when we look at certain communities, especially communities within Greater Health Now region, Benton Franklin, Kennewick Regional MSA, Asotin County, Garfield and Asotin County, Lewiston, Clarkston MSA, Walla Walla in Columbia County in Walla Walla MSA, Yakima County or MSA, Eastern Washington, which includes Skamania, Klickitat, Kittitas, Whitman, Adams, Grant, and all the other Eastern Washington non-metropolitan statistical communities have all different wages, but the standard error estimates varies. For Eastern Washington, for example, wage estimates and employment estimates, standard error estimates is larger than that for the more comprehensive or more structured communities like Yakima, Benton, Franklin, with standard error less than 10%. So these estimates vary and depends on the sampling error from the surveys that are sent from occupational employment and wage estimate surveys. But overall, when we look at if you're just starting as a community healthcare worker, you're between minimum wage and in statewide to $21 per hour. With some experience, you're about $25 per hour. And like in the middle, and then if you have some more experience and good background in education, you are about $31 per hour. Going forward, there's many different things to look into it. I wanted to compare the national concentration of employment by area. As you can see here in the nation, we are pretty green in state of Washington, but there's more concentration in more urbanized communities of employment, and New York and Eastern coast have a lot of community healthcare workers, and then southern part of California too, and then middle part of the United States is kind of here and there, not as accessible to community healthcare workers as before. But we do have green, Eastern Washington, Yakima, and Kennewick, Pasco, Richland MSA area here, and it showcases that we do have presence and a show at the national level. Something to look into is that at the national level, Seattle metro area was the 9th highest employing metropolitan statistical area in the nation. The number 1 was New York metropolitan statistical area. The second and third were California, Los Angeles, and San Francisco. When we look at location quotient and concentration of community healthcare workers, we can see that it's very spread out around the nation, and we are similar around our counties in the state of Washington. Concentration for Yakima, for example, was about 1.02, while location quotient is 2.65. Concentration is a community healthcare worker job per every 1,000 jobs available in that region. So for every 1,000 jobs, there's one job, one community healthcare worker in Yakima County. In Eastern Washington non-metro area, that's about 1.3 location quotient. It's rate of jobs per job of state of Washington, while concentration was less 0.5 2, so about half a person per every 1,000 jobs available in Eastern Washington. Kennewick, Pasco, Ritual, and MSA was about 1.29 location quotient by, but concentration is half a person per half a community healthcare worker per every 1,000 jobs available in that area. Washington State, it didn't suppress that either. It was 0.6%, 0.60 concentration, while location quotient is 1.55. When we look at statewide and nationally, the highest concentration of workers in any community was located in Carson City, Nevada, with 4 workers for every 1,000 jobs. And average wage for those workers in Carson City, Nevada was $70,000 a year. So there's something going on in Carson City, Nevada, that's really concentrating those community healthcare workers, and they're paying these workers very well, and they don't have high turnover rates. Top industries for community healthcare worker in any given area, including the state of Washington, was local government. And local government excludes schools and hospitals, for example, from the industry. Individuals, family services industry, general medical and surgical hospitals, outpatient care centers, and offices of physicians. Now we're going to look at industries with the highest concentration of employment. Highest concentration of employment was located in grant making and giving services industry, social advocacy organization industries, community food and housing emergency and other relief services industry, outpatient care centers, and individual family services. You can see that total highest employing and concentration do not match up in regards of the rate per 1,000 workers. So there's more people working as great community health workers in grant making and giving services comparison to the jobs associated in local government, for example. Top paying industries are also many very different from those employing or concentration. And top paying industry is actually scientific research and development services. Second top paying was home health care services. Grant making and giving services was third highest paying industry for community health workers. Insurance carriers was fourth, and specialty hospitals was fifth top paying industry for community health workers. When I looked at around the state, the projections and expectations for community health workers in the state of Washington, there's a lot of demand for CHW, and at the same time, there is a lot of churn. When I looked at the estimates from a projections department, over 3,608 people were estimated in 2022. By 2027, we are to grow to 3,875 individuals in the or jobs in this occupation, and by 2032, 4,149. Average growth rate a year is 1.44%, while going from 27 to 2032 will be 138. That's about 53 to 55 new jobs for community health workers within the state of Washington. But a year, we have over 1,400 to 1,500 job openings for this specific occupation. This is about 40.7% churn rate for this specific occupation. Some of the main challenges for community health workers is low wages and benefits for the skills and education required, burnout and stress and demanding nature of the job coupled with limited resources and administrative burdens, competitiveness from other employers and other occupations, where community health workers leave for better pay and stability of work. Lack of support for career growth, for example, was one of the leading indicators for individuals to leave the community health workers' jobs. And then insufficient training, supervision, and minimal opportunities for professional development. Also, there's other, like in many other occupations, like negative workplace culture, poor organizational environment can impact retention and job satisfaction for community health workers. And also with there's such a large churn rate for community health workers of 40.7%, it disrupts the care for the community and patient provider relationship is impacted a great deal. So looking forward to some of those occupations that could be supply, as well as the next steps for health community health workers. And we can see that all of them are associated to those social service skills, knowledge, abilities. For example, child, family, social school workers will hire and will community health worker experienced individuals, health education specialists, healthcare social workers, mental health counselors will look for example, experience as individuals with community health work backgrounds, so forth. So these are all occupations that rally on a community health worker experience, knowledge, abilities, as well as education too. Some of the things that really benefit community health workers is their knowledge of communities and environment and interactions of individuals from the communities with services provided in that community. So I'm giving you a sample of some of the job listings currently for community health workers. And I found in past 14 days, there was over 500 job listings statewide that got listed that are looking for skills and eligibilities of community healthcare workers. Health workers. So this is moving forward and it's in great demand. And there's so much more that challenges community health workforce, but the stability in turn is critical to establishing greater community relationship between all of those individuals that need the services and educational training towards the greater health and access to the services they have. So with that, I leave you with, if you have any questions, comments, please contact me here or just send those questions to Danny and she will let you know if she can answer or ask me. Thank you. That's it from me, Danny.
Okay, perfect. We do have a minute or two if anybody has a pressing question that they'd like to ask Aisha now, or we're also happy to pass those questions along later. Thank you so much, Aisha. It's always, your presentations are always so informative. It's so interesting to learn more about community health workers here in Washington, in our region, and the nation in large. I hope nobody in our audience got any ideas about moving to Carson City, Nevada. Any of our community health workers, but we did
Good
get a few
wages.
questions. Kate asked, does job growth expectation take into account being able to bill Medicaid starting in July?
I don't know the billing side of it.
That's actually a great, so I think what
So
Kate's
the good
asking,
segue to the next person who
yes,
does, does the billing side.
absolutely,
So I know
yes.
labor market, but the billing aspect of that is not under my belt.
Yeah, that's a good question though, Kate, that we might see those projections change as we see that billing for Medicaid, that maybe we could even see even more growth in the community health worker position.
Yeah, it's quite possible. Honestly, the changes that happened in 2014 from healthcare acts and changes since then have impacted the community health workforce as well. And the support for this workforce has changed too. I mean, going back to 2010, we didn't have this many workers in this job, especially in many different communities, especially in Eastern Washington. So the billing or how that's impacted, how the funding goes towards that will certainly impact the number of workers within that specific occupation. How that's gonna change, I'm not sure to what level, but I'm hoping that stability or churn will stabilize, is maybe go down.
Absolutely. And then another couple quick questions for you, Aisha. What is your job title again?
Regional
Rachel,
labor
should I look up
economist.
a reward card?
And then the 500 job postings was over how many days? Did you say in the last
In the
15
past
days?
14 days.
14 days. Incredible.
The
So
one of the resources I utilize to look at the job postings is the National Labor Exchange list. And the National Labor Exchange list you can type in your job title or SOC title and look for all the job listings for many different employers. Another tool is Washington State's WorkSource website. Has many listings for community healthcare workers as well. So you can utilize that, those resources there too. You can find out who are the employers listing those job openings.
Aisha, one more follow-up on that. Was that 500 jobs nationally or just in Washington State?
Washington State.
Wow, incredible.
Yes.
And then another question that might be better suited to our next presenter, but we'll throw it out here for people to think about. Is there certain certifications that community healthcare workers will require in the future?
So I looked at the certification requirements when I don't know if all of you know Own It Online website. Own It Online website is a really amazing resource. Let me show you the link. Own It Online website is a great resource for you to utilize if you're looking into the trends in any specific occupation. With this occupation, the detailed information here, it's going to list all technology, for example, needed for community healthcare workers, what they're looking for, what employers are requiring to have. Occupational activities, for example, that this occupation is doing. But then when you go all the way down here, it talks about experience requirements and training credentials. You can look into training credentials like Eastern Washington University, Columbia Basin College, Walla Walla Community College, Yakima Community College, and many other educational institutions may offer the trainings for this. But then the skills, knowledge, requirements here tells you what is needed, what most of the community healthcare workers need. And certifications is number one. If you have high school diploma certificates to, assist with substance abuse, uh, um, you know, support or help, glaucoma testing, and all of that. It just depends on where you land within each industry that you're being hired. So it depends, again, if you're for hospitals, grant making, outreach, depends which industry you're landing in, that the certification will vary depending on that. But I would encourage all of you to investigate a little bit more of details for the community health workers, information on Own It Online. And it really lists, it's so detailed. I mean, I'm not showing everything, but there's so much here that you can investigate and find out more about the requirements, needs, training, demands, and support that the community health workers are doing around the nation, not only at the state of Washington.
Absolutely. That's a phenomenal resource. I see some dialogue in the chat about the distinction between a certification or a certificate of completion. So maybe Joaquin, in your later presentation, you can speak a little bit on that. I know it's a big topic for your leadership council. So, but with that, we do need to get rolling. So again, a big thank you to Aisha. We really appreciate this information and all the resources that you shared. And I'm pleased to introduce our next presenter, Nikki Banks. Um, so Nikki is a Mississippi native with a master's in public health education and promotion and 9 years of public health experience spanning across fields such as chronic disease, maternal and child health, substance abuse prevention, and mental and behavioral health. Ms. Banks has an enriched skill set through her experience as a public health educator, but also through her experience as a community health worker, which she has leveraged in her current role as the Community Integration Program Manager. Ms. Banks is currently pursuing her PhD in epidemiology, and she hopes to use this knowledge to inform public health policies and interventions, as well provide community-driven health education to improve health outcomes, especially in underserved communities. So thank you so much, Nikki, for being here. Welcome, welcome. And you feel free to start sharing your screen.
Thank you. Thank you, Danny. Can you see my screen? Just want to make sure. Okay, great.
Yes, we can.
All right, excellent. So good morning, everyone. Thank you for having me. Today, I'm just going to be sharing some information about our community health worker Medicaid benefit, including some background about how the work got started, where we are now as far as building our SPA and our WAC, and then also take a glimpse at some of the language in those documents as well. And then we'll also look at the rates and codes. I do want to give a disclaimer that right now we are working on our billing guide, so I won't be able to answer billing questions, but you will get to see what the rates and codes look like. So let me, oh, there we go. So this first slide here is just to kind of introduce how the work got started. So in 2023, HCA was given funds by the legislature to establish a community health worker program, which would integrate CHWs into pediatric primary care spaces, where they will provide informal counseling, outreach, and social support to children and their families if they had a mental or behavioral health diagnosis or a unmet health-related social need that could impact that mental or behavioral health condition. In that proviso, we were also asked to explore long-term reimbursement options for CHWs through Medicaid. And again, this is not to replace any current billing mechanisms for CHWs, it's just to build an additional pathway. So there's 3 ways for us to implement new services through Medicaid. The first is through a Medicaid state plan amendment. And that's basically an agreement between the state and CMS about what services will be covered and how we plan to cover those services. We also have the Medicaid waiver, which allows us to kind of jumpstart a lot of pilot or implement demonstration projects. And a lot of you are familiar with that because the HCHs fall under that waiver. And then also through our managed care organization. So just embedding language for new services in those MCO contracts. And as for funding, is usually a combination of both state and federal funds. So the approach that we explored all 3 of these mechanisms, but the one we decided to go with was the Medicaid state plan amendment. And on this slide here is just how we decided to structure that Medicaid benefit. So as you can see, it says option 2. There was 4 options that were presented. I won't get in detail about those today, but they are on our HCA website for you to visit. But we reached out to the public, we presented all 4 options, and this was the one that people were most in favor of. And this would be preventive services associated with a licensed practitioner. So what that means is, because CHWs in the state of Washington are not licensed or have a credential, they will have to serve under a licensed practitioner or be supervised by someone who is a licensed practitioner. And that individual that is supervising the CHW will be responsible for making sure that they enroll themselves in Medicaid in order to be able to supervise those CHWs, help negotiate any contracts with MCOs, and also support the submission of claims for CHW services. As for the scope of services, again, this scope is preventive. So CHWs, most of their work will be centered around preventing disease, disability, and the progression of any health conditions, prolong life, and promote physical and mental health and efficiency. And by efficiency, we mean just providing any services to improve overall health outcomes. For this benefit, we do not require a state credential because we do not have one. If we decide to do one later, that work will be led by the Department of Health. And again, as supervision, again, they have to be supervised by a licensed practitioner, and then that licensed practitioner will also be in charge of handling the payments. And so as you can see, again, most people were in favor with this model because most services that CHW provide are preventive. And then also this method reduces the administrative burden on CHWs as far as enrolling as a Medicaid provider themselves and submitting claims, as that's completely new to community health workers. As far as overall benefits, this does expand our CHW service to our Apple Health enrollees. And also it allows CHWs to be embedded in other places that they usually aren't hired. This slide just gives an update on where we are now. So we did submit our state plan amendment back late September, close to early October, and we received an approval on November 27th. You can also find that document online. I'll also attach it a little bit later. We also worked on developing our WAC, and our WAC is going to be our rule book, and you'll get to see some of the language from that. And so basically that WAC just pretty much sets the guidelines around the scope of services, education requirements, and so forth. So we had a public hearing in February to give feedback on that document. We made some changes, and the final document was posted on March 19th. So it is on our legislative site. As for the billing guide, we are currently in the process of designing that document with the intentions to have this posted by April 1st. Once we have it posted by April 1st, HCA is going to be hosting a number of TA calls just to provide some clarity around the billing guide and also just give some support around provider enrollment and claim submission. And also this benefit does extend to our managed care contracts. So we have updated our managed care contracts just to make sure the language aligns with the benefit as far as the services that are covered. And that new language will be in the MCO contracts on April 1st as well. So now I'm going to share some language from the WAC. Again, this is our rule book. So the first thing is talk about client eligibility. So for someone to receive services by CHW for this benefit, they would have to be someone enrolled in Medicaid, fee-for-service, or a managed care plan. Those services must be recommended by a physician or a licensed practitioner. So this, again, is someone enrolled in Medicaid. And that the need must be either an unmet health-related social need. It can be a positive ACEs screening. It could be a serious high-risk condition, such as a chronic condition. If that client has 2 or more missed medical appointments within the previous 6 months, that also qualifies. If the client themselves, or if they have a spouse or a family member who expresses a need for additional support in health system navigation or resource coordination, that also qualifies. And then also the last 2, if they meet the need for recommended preventive services, or if the condition is something that requires ongoing monitoring. And so again, that falls back to like those high-risk conditions. As far as initiation and recommendation, again, CHW services must be initiated and recommended by a licensed practitioner. During that initiating visit, the healthcare professional that's recommending the services must identify one of those needs that we talked about on the previous slide, establish a plan of care, and then also provide a written recommendation to that community health worker. This slide here talks about education requirements for CHWs. So in order for CHWs to be reimbursed with the Medicaid, again, they must serve on a licensed practitioner. They must also have lived experience that aligns with the community that's being served. They must also have 2,000 hours, supervised hours working as a CHW, and they can be in a paid or a volunteer position in the last 3 years. And then they also must be able to demonstrate the following skills and core competencies. And as you can see, that's going to be like communication, advocacy, outreach, individual and community assessment. So there's a total of 10 core competencies. And we did align with the current DOH CHW training provides. And I'll also share a link to some resources that you can use to learn more about how to assess for these core competencies as well. As for training, CHWs can participate in the DOH training, or for CHRs, they can, if they want to take the training that's offered by the through IHS, that is also fine as well. Or if their supervisor wants to appoint them to a training that's more more in line with their scope of practice. So again, let's just say you are a CHW who works with clients around hypertension and diabetes. You may be asked to take a training that's specifically focused on that subject. And so down here at the bottom, we list just an example of some of those trainings that you can participate in. You're not limited to these subjects. It just depends on what your scope of practice is. As for continuing education, CHWs must complete a minimum of 6 hours additional training annually. And the supervisor is responsible for making sure that they keep up with all documentations pertaining to training and continuing education requirements. And any CHW who does not meet any of the previous requirements that we just discussed, they can still be hired, and you can go ahead and start to bill for that community health worker, but they must obtain those necessary requirements within 18 months of employment. And then the bottom just states that CHWs must obtain client consent before providing any services. And that consent could be verbally or in writing. As for covered services, I know there's a lot on this slide, but for covered services, this benefit will be covering person-centered assessment and planning. That includes certain assessments or screening tools that are approved for community health workers, care coordination and system navigation, any support with facilitating behavioral change. So there may be some counseling around maybe self-management, and then also health education and promotion. So those are the services those are the buckets of services that are covered for this benefit. Now, what this benefit would not cover are things such as clinical care management, because again, CHW's roles are preventive, so they should not cross over to that point of becoming clinical, or anything that requires a state credential. Child care, chore services, companion services, employment, enrollment with any government program or assistance program that is not related to improving health, delivery of medication, medical equipment or medical supplies, respite care, services that duplicate another Medicaid covered service, socialization or transportation. So those services are not covered under this benefit. And any services that is recommended by EPSDT that is not covered, the agency will have to submit a request, and we will go through our standard process. And you can see more details in this WAC here. And I believe Danny's going to send a copy of the slides out, so you can have that as a reference.
Oh, perfect. All right, Stacey, you're up. So you have a question?
So I'm also going to move to the rates and the codes, and then also the two big questions that we've received. So the first code here is G0019. This code covers community health integration services. So that means anything that is a unmet health related social need. So that's food, housing, transportation, and so forth. This does cover all of the services such as health assessment and screenings, health education, care coordination, system navigation, and social any type of support with getting connected to social support services. And so as you can see, the primary code here, it does offer two separate rates. One is a non-facility rate and one is a facility setting rate. The first for non-facility is going to be $47.83. And then for the facility setting, that's $28.85. And this code does cover up to, it covers 60 minutes per calendar month. So in order to build that service, you have to do the full 60 minutes. And then the add-on code provides an additional 30 minutes per month. The non-facility setting rate for that is $29.80. And for facility, it's going to be $20.12. So this, again, these two codes, G0019 and G0022, are for community health integration services. The next set of codes here are for our principal illness navigation. Again, this is for more high-risk conditions. So again, those chronic conditions. The primary code here, 0023, has a facility, a non-facility rate of $47.83. And then for the facility fee is $28.85. So the same as you saw for community health integration services. The add-on code is the same rates, $29.80 for non-facility settings and $20.12 for our facility setting, and that does cover an additional 30 minutes per calendar month. The only difference with this is that these set of codes do not cover health education. So because of that, we did include two additional codes. The first, and again, these codes will be only used for health education for a principal illness, since the community health integration services, their code already covers that. So the first code is for individuals, and you have the same rate for facility and non-facility, so it's $14.74, and that covers 15 minutes per month per session. And then the secondary code is going to be for groups, and that's $5.26 for both the facility and non-facility rate, and then that also covers 15 minutes per month per session. And again, just want to note that rates tend to fluctuate, so it could change by the time we launch the benefit. Usually there's an increase instead of a decrease, but at this time, we just want to share those rates and codes as they are now. You would not be able to bill for these codes until July 1st. So although we're showing them to you a little bit early, you cannot bill until July 1st. These last two slides are covered questions that have really popped up.
Could I ask a question?
Sure, I was going to wait to the end because I want to make sure I cover all of my slides.
Okay, that's
Do you
fine.
mind? Yeah, I'll circle back, or you can put it in the chat. I just don't want to not cover everything. So I put some questions that were more tied to the ACH. So the first question that we received is, what does this look like for the community care hubs, which is going to be a new project, I believe, under the MTP waiver. And so we reached out to that team, and the way this is going to be set up is that the HCHs are going to be responsible for developing, overseeing, and managing a community care hub. And that community care hub is going to be serving as the central source for connecting individuals to any services for addressing health-related social needs. And those community care hubs will receive referrals, can receive referrals directly from community organizations, community partners, healthcare facilities, correctional institutions, as well as governmental bodies. And as for making sure that any community-based worker hired through the community care hub has the support they need, they will be connected to someone through the HCA who has that experience that can provide that support. The next question that we have been receiving is, does this exclude community-based organizations? It does not. The way this will have to work for community-based organization is first that their agency will have to enroll as a Medicaid agency. That's the first thing. And then they will also need to hire a contract with someone who is a licensed professional to provide supervision of that community health worker. Because again, CHWs have to work under someone who is licensed. And as for recommendations, again, they can receive referrals and recommendations from a number of groups, very much similar to what was on the previous slide for our community care hubs, as long as that recommendation comes from someone who is licensed. And so that is the end as far as the primary information. I'm just going to put this up as far as what our next steps are. Again, we just finalized our WAC. So our plan is to have the billing guide posted on April 1st. And then between May and June, we'll start providing TA calls to all different groups, just to make sure everyone has a complete understanding of what the information states in the WAC, as well as the billing guide. And then again, the benefit will go live on July 1st. You can start billing for community health worker services. And this is kind of how we plan to section out those TA calls. So pretty much everyone would get like a separate call for their group. That's how we plan to do that. And that is my last slide, so I can go ahead and take questions. Comments.
Stacy, do you want to kick us off on questions, and then I'll scroll back through the chat and facilitate some of those questions?
Yeah, that was a lot of information. So I was trying to keep track of my questions. Unfortunately, I'm fairly confused. So are we using the word CHW and CBW interchangeably, or were we just only talking about community health workers?
So the benefit is set up for community health workers. Now that encompasses a wide range of titles, as the last person shared on their presentation. So community-based work is just what they would be called for the Community Care Hubs project, but they still are technically community health workers. So they still fit under this benefit, if that's what you're asking.
Yes. So we, as an agency, are supposed to provide the supervision, or that supervision, my understanding was that was coming from Greater Health Now.
So for the HCHs, I'm not sure how this is set up with you all, but the person that is providing the supervision needs to be a licensed person, someone who is enrolled in Medicaid. So within the ACHs, you will have to appoint someone to provide direct supervision for those community health workers. I'm not sure how supervision currently works for the HCHs.
Yeah, so we, I know a lot of us are coming in as new contractors, so my understanding was that, you know, we hire the community-based workers. We do provide also a supervisor for that person, but as far as like the clinical level supervision, that would come from our collaboration with the Greater Health Now.
I mean, that's fine. That's how that's set up, but the supervision would need to be by someone who is enrolled in Medicaid. So I'm not sure if the HCHs themselves are enrolled, or these are community-based organizations, right? So they're not enrolled in Medicaid.
So
I
we,
don't- Greater
Nikki,
Health
so
Now
we
is-
have training resiliency. I'm gonna answer this the best I can, Stacy. We can also kind of set up a separate call. So we're a little ahead of the curve in that we are able to provide that training resiliency support through your contract. And so I'll double check with Anna on the Medicaid billing piece, but we are providing that supervision via that secondary contract.
Okay, okay. Wanted to get that straight in my head. And then the codes, we as a community-based organization, separate from Greater Health Now, who is our contractor, or who provides our contract, we can, as a community-based organization, enroll with Medicaid and bill for those codes eventually after July 1st as well.
So there are some community-based organizations that are seen as medical settings, and they are able to enroll in Medicaid, and that's if you're able to do that, that's fine. For those nonprofit community-based organizations that don't usually provide medical services, they will have to contract either with a FQHC or any type of medical setting to be able to employ and recommend services to that community health worker. So that's the way it will have to be done for those type of community-based organizations.
Okay.
Because I know I know CBOs is quite broad, because you have community health centers who are medical facilities that are enrolled in Medicaid. Then of course you have some CBOs that are not medical settings. So for them, that's the way they will have to approach that. They will have to contract with a medical setting.
Okay. Okay.
So does this only apply to organizations that want to bill Medicaid directly? Like, for example, an organization that is hiring CHWs on a grant, but not billing Medicaid?
Yes, this is only if they want to bill Medicaid. There's different
Okay.
funding mechanisms for funding CHWs. for the longest, it has been through either grant funding or like the MTP waiver, but this is a direct path through Medicaid.
Okay, but it's not required to go this route to direct bill Medicaid.
If you want to build Medicaid, this is the route
Okay.
you have to take forward. Community
I
health.
think I understand. Thank you.
Yeah, you're welcome.
So we have a lot of questions in the chat. I'm going to get to as many as we can, but I also want to mention that we will continue this conversation. We have already talked about potentially bringing Nikki back after the billing guide is published, so that more information is available and some of these questions may be answered in that billing guide. And then additionally, next Learning Collaborative next month, we are going to talk about the process of becoming a billing entity. We will have the Healthcare Authority back to talk us through that process. So for anybody that might be interested in becoming a billing entity, we'll talk about those first steps that you would need to take in order to move towards being able to bill for CHWs. So definitely plan to join us next month. We have just a minute or two more, so I'm going to see if I can get some of these lower hanging fruit questions. So Nikki, I have a couple more for you.
Danny, I don't want to cut into the next presenter, so I can hang back and answer questions via chat if that's helpful.
Yes, that would be awesome. There are quite a few in the chat. Are you good to reply to those as we roll into the next presenter?
Yes.
Okay, that would be wonderful. Thank you so much, Nikki. And again, we know there's a lot of questions around this, especially as it pertains to how this will specifically look for community care hubs. We're actively continuing to explore those questions with the Healthcare Authority, and we'll bring you those answers as we sort things out. So we commit to you to continue to bring you those continued answers. So I am going to roll into introducing our next presenter, Joaquin Vidrio Ruiz. And Joaquin was born and raised in the Yakima Valley and is dedicated to serving the community. He is strongly passionate about improving health outcomes. He is bilingual with a bachelor's in public health from Central Washington University with specializations in community health. Joaquin has been with CHCW for 7 years, focusing on improving access to care and engagement. He is also an avid fisherman and loves to explore the outdoors and all the great things in the Pacific Northwest. Being raised in the Yakima Valley and by Latino parents, Joaquin is extremely passionate in ensuring that his community can access care in a culturally competent way. And with that, I will turn it over to you, Joaquin.
Good morning, everyone. Thank you for having me. So I hope not everybody is already overwhelmed. I know that's a lot of information, and it's very, very challenging to kind of wrap your head with all the different roles across the state, across the nations, and how people decide to really name their community health workers. But I hope that after this, I can kind of share with you a little bit of what the Community Health Worker Leadership Committee. Again, my name is Joaquin Vidrio. I work for Community Health of Central Washington, so I am in the area, but I am the chair for the Community Health Workers Leadership Committee for Washington State through the Department of Health. Let me see if I can move my slides forward. So for today, we'll talk through increasing your understanding of community health workers and the work that the Leadership Committee is doing, the structure of the Community Health Worker Leadership Committee, what we're focusing on this year, and then some of the projects that we have ongoing. So just some background. The Washington State's Community Health Worker Task Force from 2018 to 2019 recommended that there would be a leadership committee that was majority community health workers and had involvement of some priority stakeholders. And this committee would meet ongoing, convening to provide guidance related to community health worker workforce. And then secured funding was offered to make sure that this work was carried out. The guiding principles of the committee are to center community health workers, promote health, and provide services to the community. So our mission is to really develop and promote a framework that will support community health workers across systems of care and improve quality of life for every Washingtonian. Our vision is advocating to elevate the profession of community health workers in Washington State. I do want to add something to this. It doesn't really mention anything about CBOs, but that is something also that we're really focused on because community health workers are also found in our community-based organizations. Our current structure for the Community Health Worker Leadership Committee is we have a chair, that's me. We have a chair-elect, a person that is kind of, since it is community health workers led, we really want to foster the learning between community health workers. So that person is kind of learning and kind of getting to fit whether what the position will look like for next year, and the next year they'll be the chair. And then we'll have a past chair, which supports me and supports the committee. Then we have subcommittee liaisons, which are also community health workers that do reports out within each subcommittee. Then we have the community health worker leadership manager, which he does a lot of, hopefully, unfortunately, John is not here today, but he does a lot of the organizing as well with us. And then we have subcommittee members. We have a total of 25 committee members, right, that are available to have positions. Right now, we don't have that much. We have 5 open positions, and we're currently looking for other community health workers across the state that are willing and wanting to participate in elevating the workforce needs. This year, we have 3 focuses. And from our vision and kind of working with the leadership committee, I came up with 3 major topics to really guide the work for this year. And one of them is network mapping to connect with community health workers across the state. This is the most important one for me particularly, and I know that the chair-elect also shares that this is what she will be focusing on this year. As you kind of got a sense of it, it is really hard to connect with the variety of community health workers that there is. Every organization decides to call them a different name. There's so much different titles that fall under that umbrella of community health workers. And really, while some counties do a better job, like Greater Health Now, and to really connect with their community, not other counties do the same. So there is a very much of a disconnect from what supervisors are able to have to offer training for their employees, as well as employers that are looking to start these new programs to find resources to have that. So really creating a system to network across the state will be essential and key to further the work across Washington state. And then increase communication with community health workers and stakeholders by providing learning opportunities and ways to connect with the Community Health Worker Leadership Committee. And I'll talk a little bit more of that in further slides. And then again, since it's about 70% community health workers that are in this committee, the focus is to develop their professional skills so that their work is able to be elevated and provide guidance. So we have 4 active subcommittees. One of them is the operations. Since the Community Health Worker Leadership Committee is not new, but it is community health worker led, we kind of had to create a structure. So the operations committee works a lot on workflow, logistics, and just daily operations to make sure that the work continues to be furthered. Then we have training and education, and this is directly targeted at community health workers and their supervisors, and providing trainings on the different needs that community health workers might have. We are still in development of these different trainings and looking for different individuals to connect with that offer these trainings because there's just such a broad role of roles that community health workers have. Then we have the employer support, and then they're focusing more on the employers and promoting long-term retention. So that's providing the employers with models of what it looks like to have a community health worker, how individuals get paid, how those different structures look like, and how they can foster a way of learning for them. There's just a different need between them. And then sustainability of growth, which I guess is the one that's getting the most attention right now with the HCA's new billing methods. Just to touch a little bit on that, the Department of Health does offer a certificate of completion. That is not a certification. There is not a certification in Washington State for community health workers. It's just a certificate that you completed a training. And I'll talk a little bit more about what that sustainability and growth group is working on and what they're hoping to accomplish. And the last one was visibility and infrastructure. This is one that with current our current structure, we really haven't been able to work on. Just there's not enough individuals right now in the committee to really make sure that that work continues to move forward. So right now that one's kind of on hold, but we will be working towards making that an active committee once again. So again, our operations subcommittee is really providing leadership for the committee, making sure that we're selecting new community health workers. Right now we have 5 open spaces. This is why I put this slide on here. So if you do have community health workers at your site, we do have a pretty rigorous approach in how we select community health workers to participate on the leadership committee. And the reason that is done is because we want to make sure that everybody in the Washington State is represented to the best of our abilities. We were looking for Native Americans that support with Indian health, individuals that might support um, uh, a lot of different ethnicities and members of our community, for example, substance abuse disorder professionals, people from CBOs, etc. So feel free, I will put a link at the end for you to be able to apply if you are interested. And then again, this operations committee is the one that's primarily focused on networking framework. And that's to make sure that we develop the right relationships with the right people that are invested in community health workers, that center their work around community health workers uh, to connect with each other and make sure that we keep the work moving forward. Um, this group is really focused on keeping in the intensity and creativity to make sure that if there is conflicts, that we resolve them, find creative ways to celebrate the small wins. As you all know, this is a very laborious task, what we're trying to accomplish. There's just so many different roles. So that's what that group focuses on. Now, training and education. I guess this is the one that really has been moving forward recently. And right now, they have created a Facebook page. We're hoping to see more training opportunities for community health workers. I couldn't find the link prior to this presentation because they were working on it, and so they deactivated for a second. So if you are interested in connecting, I would recommend going on that Facebook page and connecting with the different community health workers. If you have events, if you have trainings that you have available, it's a good way to get us connected. And they're also developing different ways to connect with folks. So again, that's why it's important that you kind of subscribe, right? This would be my the media outlet for today. So please like and subscribe if you once I'll probably send over the link for the Facebook link. And then employer support. Employer support, again, really focusing on giving the employers the best resources possible so that they can form sustainable programs. As we heard from Nikki just now, that is just one payment method that exists. Hiring community health workers does require a little bit of flexibility and creativity in the way that you uh, maintain your program. So of course, there's things like braided funding, which organization is funding what, how do we collaborate to make sure that our community is getting the resource that it needs through a community health worker, and what training do we offer them. And then so this year we will be hosting a training and hopefully multiple as we continue, and then they will be made public live, probably on the Facebook, probably in the Department of Health Community Health Worker website. But the first training this will be coming up in May. We haven't published the invitation for that. So if you are interested in that as well, please let us know. And then further explore further partnerships. So this one here requires a different level of partnerships, right? So employer support really focuses on making that relationship with employers. And training and education is really focused on making that relationship with community health workers. And sustainability and growth. So this group actually worked very rigorously on the HCA's rulings, and they worked together. We had a representative from the the healthcare authority, that would come and visit us and ask for some guidance. Well, not more of like, what do you guys think? Do you think this would work? So I'm glad that Nikki answered that CBO question, because that was actually one of my main questions. We know that there's a lot of community health workers that work for CBOs. So how do we make sure that they are also able to have access to that funding and or training that is required? These individuals are also really focused on helping the Department of Health formulate what the current community health worker training looks like. And that could be a very rigorous task, because we've had to make some changes. And actually right now we're going through a major change. And you will see it here shortly, and there is a very good rationale behind that. Sorry, so I'll talk about it here because I thought I had included a slide about it, but that certificate of completion is being changed to have more encompassing roles from the C3 standards. If you're not familiar with what the C3 standards are, I would recommend that you take a look at that, because across the nation, that is what is doing creating the drive for change and reimbursement models for community health workers. And so by the Department of Health really focusing on making the community health workers training follow the C3 standards, we were setting ourselves up to be able to access some of those funds that will hopefully be coming down and channeling its ways down the line. So let's see. Yeah, here within the next 3 months, I believe is what I recall, we'll be reviewing those new trainings. And hopefully sometime later this year, you'll be seeing an updated version of the Department of Health's community health worker training for completion of certificate. So we continue to actively work and engage with community health workers across the state to center our work around them. Right now, there is not one channel across the state that community health worker can turn to really get information about what's happening across the state. Individuals have to rely within their own county, and usually that means relying on accountable communities of health. That sometimes means searching out with other peers, especially those are self-employed. So finding trainings, finding support with different things has been something that community health workers have mentioned that has become a challenge for them, as well as fostering a relationship with those at large, right? So those employers, those government agencies, there's a lot more that goes into that, but I'm not going to go into it in this meeting. And then promoting strong allyship, because this work does become strenuous, as some of you all know that run community health worker programs. A lot of us are running on just funding that continues to run out. You have to reapply for new funding next year, and it might not be available. It might be a grant funded. Your employer might choose to fund a certain program that year, and the next year it might not. Community health workers, especially during COVID, were very much utilized to do COVID care coordination. After that ended, we had to find something new and find better ways to utilize them. So because of that validity, it is crucial that we create methods to have a sustainable workforce. And the current, and I already mentioned that we are making sure that Department of Health training is appropriate and well aligned with the C3 standards. I kind of rushed through this because I think a lot of you have a lot of questions more for Nikki, because that is the new thing that's kind of happening. We are focused on making sure that we better understand that as well, because there's a lot of questions that we have community health workers. What if they don't meet those 2,000 hours? How do we get them to meet those 2,000 hours? How do we set up for reimbursement? So there's a lot of those questions that I hope that you probably won't be able to answer now since it hasn't started. Of course, like everything new, we have to kind of wait for that. But with that, thank you so much for your time. Um, if you are wanting to apply or have community health workers at your site and want them to be more involved in the leadership committee activities, or if you just want to chat, like what are you guys working on? Hey, I would like to partner. I think I have some ideas for you all. Feel free to either to email me, and if you want to apply, um, the email address is right there, and it will lead you to the Department of Health Community Health Worker Leadership application. You can also go on Google and type in Community Health Worker Leadership Committee, and there will be an application in Spanish as well available if you do have those community health workers that are Spanish speaking. Or if you need it in a different language, feel free to reach out to me, and I can try to assist with that. Thank you.
Thank you so much, Joaquin. We really appreciate it. It's been so phenomenal. Greater Health Now has stayed connected to Department of Health around this initiative and are so grateful for the voice that the Department of Health is giving to current community health workers. And I know there are some awesome community health workers on this call, so I really encourage you to talk with your supervisors and consider applying because we would love to have your insights contributed at the state level. So with that, I think a good plan of action, as you may have seen, Nikki has been responding to some questions in the chat. We will pause for a second here for questions just for Joaquin, and then we'll roll into our next segment. And then at the very end, we'll wrap up with a time to ask questions for any of the presenters. So if you still have one stewing at the back of your mind for Nikki that you'd like to ask, we can ask that at the very end. But any questions for Joaquin before we roll on?
I have a question. I'm not sure if it would be better for Joaquin or Nikki. Um, I guess I'm a little concerned from what I'm seeing in some of this, where there was some talk about, requiring bachelor's degrees and things like that. And I guess I feel like that kind of goes against the original thought of CHWs being, folks from the community who identify with the community, lived experience with the systems we're working in and things like that. So I guess I'm concerned that if we're going down that road, and then the second thing would be the Medicaid reimbursement process. I think that, having, worked at nonprofits who bill Medicaid and things, that the reimbursement rates are so low that just reinforces the churn of CHWs, because that makes it even harder to pay them well. So I guess I'm wondering what your thoughts are on that.
Great question, Christina. I'll answer this briefly, and Nikki, feel free to jump in here if you have anything additional to add. So what the HEA is working on is directly tied to being able to build Medicaid. There's a lot of different ways to find funding resources for community health workers. As far as certification goes, the reason it's such a difficult task is because a lot of individuals with certification might lose access to still be community health workers, right? There is that, to me, the definition of a community health worker is a trusted member of the community that is able to relate health education or education to better the health of the community. With that certification process, the concern has been that individuals who are peer educators, let's take into account substance abuse, right? Somebody that has gone through substance abuse, somebody that has gone through the appropriate channels to get themselves clean, knows the process, knows how difficult it is, being able to serve as a community health worker to guide others to also be successful in that way. Or let's say that Pacific Islander, being able to have somebody from your community that is able to relate to you, that knows the culture, that knows how to engage individuals, that knows maybe some of the challenges that the community is, that is able to better connect with that member just because of that direct relationship that they might have. Or even somebody, let's say that you live in the Yakima area, you know where to find the different food banks, you know where to find the different health resources. You might know how to navigate the system very well. Uh, those are the challenges with certification and why it's such a split divide and why we still don't have a certification process. There's not a one size fit all solution. Uh, and it's because every organization, even nationally, struggles to just use one specific term for community health workers. We use liaisons, we use outreach workers, community health educators, peer educators, as it was very well put in the first presenter's presentation. That is some of the challenges. And even as I was going through kind of hearing some of the demographics, does that demographics even account for every community health worker that there is? Every organization, as they find funding or as they find a need, will choose to name their employee whatever they choose to, depending on the task that they're going through. Uh, so yes, the concern is very much heard, and we are aware of that. It's just a matter of getting to a point is where do we find that middle ground? And how do we connect with individuals at the state level that are community health workers that we can get guidance from and how that would look? We had Watchwa at one point. That organization has slowly disappeared. There's intents to reorganize that, but the only place that most individuals either turn to again is accountable communities of health or just individuals that they know. So that is why the leadership committee right now is really focusing on creating that one channel of communication where individuals can have bi-directional communication, and be able to support that task force in a better way and get there by. Very important question. I really like your question, by the way. Nikki, do you have anything to add to that, or I know that.
Something in the chat, but just to clarify, for this Medicaid benefit, we are not asking or restricting CHWs to having a bachelor's or a master's. We are just asking for them to meet the training and education, the training requirements and the lived experience. Now, if we do decide to establish a state credential, then that does change that because there's a different set of rules that can be imposed through a credential. You can say that somebody has to have a bachelor's, or another question that has come up is around CHWs who may be undocumented. Maybe they have a what is it, a individual identifier text? I can't think of the exact wording, but if they have that instead of a social security number, then how does a credential impact them? Because some credentials may set the limitation that you have to be someone of legal status. So there's a lot of pros and cons to establishing a state credential. And so I know DOH has been doing this work for a while to kind of assess kind of how people across the state feel when it comes to establishing a CHW credential and whether or not we want one. But again, those are some things we do need to be thinking about if we decide to establish one, because that will ultimately change the Medicaid benefit as well. And I think you also asked a question about the rates for CBOs. Again, I think for CBOs who are technically non-facility, they will have to use those, they will get those specific rates for any non-facility setting. I think that'll be different from like a community care organization that is a medical entity and has been able to enroll and bill Medicaid. So that's why you have those two different rates. And so, yeah, there's a lot of things that we'll have to provide clarity around, but again, around the billing piece, we have to wait until our billing guide is posted before we can confirm anything, because a lot of things can change between now and April 1st. So, But yeah, I also put the link to our Gov delivery, so you may want to sign up for those. That way you receive alerts from when we're hosting community calls, because once that billing guide is posted, I'm gonna go ahead and start providing calls to the community to kind of go over that billing guide and make sure everyone understands the details.
Thank you both for your answer. Joaquin, how do you get involved with the leadership committee? Can you post a link or something of how it sounded like you have opening?
We do have openings, and I'm glad that you're wanting to get involved. Let me see if I can put it in the chat briefly, and we would love to have more representation, especially from the east side of the state.
Fantastic. So hopefully Joaquin can put that chat in the, or that link in the chat rather. And then we will also, it is on his last slide. There was a link to apply for the committee, and we will send out the slides following the learning collab. So I am gonna keep us rolling. Let's go ahead and do our last segment with our panel of community health workers, and then we'll circle back for any last questions. Feel free to continue to put questions in the chat, and both Joaquin and Nikki, if you don't mind, just checking the chat to see if there's any questions you can respond to that way. But I'm gonna go ahead and share my screen here just to quickly introduce the panelists, and then I will minimize my screen so that we can see our faces as we're chatting here. But we have a wonderful group of CHWs who are here to talk about sort of their current experience with the CHW role. So we have Fatima Andraka, who's a community health worker with Kittitas County Health Network, Shelley Slaybaugh, who's a community health worker with Southeastern Washington Alliance for Health, or CWA, and Jen Pimentel, who's a community health worker with Yakima Neighborhood Health. So our first question for them asks them to introduce themselves a little bit more. So I am going to stop sharing my screen and jump right in. So our first question is, can you briefly introduce yourself and your role as a CHW in your unique context? So I will pass it off. Jen, do you want to maybe kick us off, and then you can pass it off to your fellow presenters?
Yeah, of course. Can you hear me okay? Okay, great. So my name is Jen Pimentel. I work for Yakima Neighborhood Health Services here in Yakima. I've been a community health worker for almost 3 years now, and I absolutely love this job. We mainly focus with the underserved in the community, and in response to your question, I would say we are, as community health workers, are the front line to assisting our clients with breaking barriers for their healthcare needs. And that can range from anything from transportation, housing, essential needs, digital literacy, insurance applications, assistance with benefits from the state. It could also look like just assisting them with getting them a meal or a change of clothing for the day. So that's what I would say for that question. Okay.
Go
Okay,
ahead,
I'll go.
Fatima.
Oh, sorry. Okay, I'll go next. So I work at Kittitas County Health Network. We're a 501c3 nonprofit in Ellensburg, Washington. So it's a very rural area. We serve all of Kittitas County. And the mission of our nonprofit is to advocate for whole person health through collaboration and connection. And I also am subcontracted through Greater Health Now. So I'm a promotora. So what that means is my lived experience in the Hispanic community. My community has helped me become trusted with our clients. And through Greater Health Now, we've implemented a 5-pillar framework for the promotoras. So to serve the Hispanic community, which consists of advocacy, outreach, community resource fairs, education and prevention, and individual navigation to different services for our clients.
Wonderful. And Shelley?
Yes, I've been a community health worker for about 3 years. We help our community members in a number of ways. We address barriers and access to care, ensuring a safe place, healthy living, stress-free life as much as possible, so that they can stay in their homes and thrive. But also food access. We help with heaters and blankets in the winter, fans and cooling rags in the summer, food boxes when needed, and just connecting them to the resources in our rural community.
Yes, wonderful. Thank you all so much. It's great to get to know you a little bit, and we're excited to hear. I have just a couple of questions for you. I'm going to start with what helps you make you successful as a community health worker? So, what helps make you successful?
I'll go ahead and start with that. I think teamwork. More than anything, teamwork has to do with us being successful as community health workers here within YNHS. And the reason that I say that is because even though we all have access to the same education, we all have the same trainings, we all have the same access to resources. Each one of us has worked with individuals, like say for example one getting hearing aids, another person is particular or their specialty could be with paid family and medical leave applications, and I think with all of us having a little expertise in those areas, we all lean on each other for that help or assistance when we need it. So I think that is one of the main things. Another is that we have a leadership team that has an open door policy. So anything that we have an issue with, we can bring to them without questions asked. I mean, they will help us hands down, no, um, they'll help us work through it. So I think that that's also another huge thing in being a successful community health worker.
So I would say that for me, being a successful community health worker is being able to network with partner organizations. I think it's important to have a point of contact. Oftentimes our clients get discharged from the hospital and they don't know who to go to. So it's very important to have that trust with our community. And I also think to be a successful community health worker is definitely meeting clients where they're at. So I always strive to empower the clients with the resources and the supports just to ensure they feel safe, seen, and heard, and just to help them be healthy and their well being.
Growing up in a small community, being here all my life, I've built a lot of relationships with my community and stay very involved in the community and activities and groups. And that definitely helps with making connections and having that trust. And also having a care team that we meet once a month and we talk about how we can help each other and also help different clients that they may have a need. And that definitely helps us to fill in those gaps.
That's wonderful. I hear you all saying you're not doing this job alone or in isolation. It's a team effort. You're connected to your community, to your team, and that's really what's helping you get through. And that's just incredible. Those relationships are so important. So, one last question for you, and then I'll open if the audience has any questions. But today's webinar is titled "The Growing Role of the Community Health Worker." In what ways do you see the community health worker role growing?
So when I started as a community health worker, I was mainly contacted like applications, for SNAP benefits through DSHS, or to get a meal, or do you have any extra clothing? I've noticed that within this past year, us CHWs here, we've been integrated into the medical field as well. We can work alongside providers, medical assistants to help the families, that have insecurities within the home. Or we've also become the face and front line, sometimes even the first contact with families or individuals in the community even that need our assistance and don't know where to go. So we also do outreach. We have mobile events. We have Yakima neighborhood showers where we offer the community a place to come and get clean clothing, a meal, offer services. You know, we do that as well, and we can get them resources that they're needing, and build those relationships and that rapport with our clients, and the community as well. We don't just focus on, you know, a certain group of people. If that's what we're leaning towards in that meeting or in our events even, then, you know, yes, that's what we'll focus on, but we help everybody that we can. And also I've noticed that us community health workers, we are the trusted sources for community service, and sometimes we are the only touch point for vulnerable and underserved populations. We also do focus on follow-ups with our clients, and they know that once we assist them, they're still not going to be alone. We do follow-ups, you know, to make sure that they know that we are still there to support them with anything that they might need that we can help with.
I would say that our role as community health workers is definitely growing. I started working 3, 4 years ago, so this was during COVID-19, the pandemic. And I do remember there was a lot of fear within the Hispanic community, and no one really knew who to seek for resources. So I would say, you know, the Hispanic community has been historically marginalized, and it's been difficult for them to trust the systems. So I would say I think it's crucial that the community health worker role has been growing, just because like mentioned, we've played critical roles in just providing navigation and supports to address different ongoing needs. And I think this work that we do is really awesome and great, and I hope it continues.
I would say in our rural community that there are challenges that have come to our attention, mainly with food access. We decided that maybe besides having the food bank, and we also have Meals on Wheels, that to serve a bigger community, our community would be to bring in Second Harvest, and they don't ask any questions and they can just come and get food, and that has been very successful. We usually average around 230 families, and I think, you know, just recognizing the changes in your community and how you can help is important.
Absolutely. Thank you all so much. We really appreciate it. I do have a question in the chat here, which is, how do you like to be recognized? And then where do you get your current CHW information? How do you stay up to date on CHW happenings?
Sorry there, I disappeared for a sec. Honestly, we have a great leadership team. They're the ones that keep us up to date almost on everything. We have them to lean on and look forward to everything. We have weekly meetings as CHWs here within Yakima Neighborhood Health Services. You know, we meet and then we get put up to date. You know, what's next, what's coming, what can we fix, what's working. So that's something that's really, really great for us.
I would say that for me, I always try to stay up to date through the Department of Health, checking to see if there's any updates just on, I know we recently just had a training through Greater Health Now. We're working on that. It's like through Camden Coalition. So I always try to stay updated through that and to see how I can better support my community.
Honestly, I don't know that I do that very well. But we do have our group meetings that we do address different issues.
Fantastic. Any other questions from the audience on something you'd like to hear from current CHWs working in the field? Any insights that you could use from them? I see a hand. Oh, Brian, I thought you might have a question or two for this group. I'll turn it over to you.
I do not have a question. I have more of a comment. I have the privilege to work with Shelly, Fatima's, and Jen's teams. And I just wanted to say that they sold themselves short. There is not enough time in this webinar to share all the beautiful, wonderful things that these gals do and their teams do, providing the support to our underserved and disadvantaged. So I have to just say they sold themselves short. They are heroes in their communities. And thank you for everything you do.
Thank you, Brian. That was so well said. Yes, thank you so much to you three and all the other community health workers on the call today. We really, we're convening and we're having these dialogues about these important topics related to the work that you're doing, because at the end of the day, all we want to do is help you be successful in the absolutely critical work that you all are doing. And so we love to amplify your voices. And so I guess I'll leave you off with one last question. Is there anything else that you'd like to share, that you'd like the audience to be thinking about as they're thinking about the future of CHWs?
The one thing that I could think of is just know that it's never the same. Community health work is ever changing, and there is always going to be a challenge coming up when you least expect it. And we find them on the daily here within Yakima Neighborhood Health Services. So just keep that in mind. But we are very thankful and grateful for our community, for all of the resources that we have, and all of the individuals that support us in groups and organizations. So thank you so much for having us here and for supporting us and being there. We really appreciate it.
I would say I would agree too. Thank you for everyone for listening to us and giving us this space to just share our experiences. And I also want to give a shout out to Nicole and Brian and Danny, Maria for all your support. And thank you so much for all your resources.
I think it's a real privilege to be able to serve the community and be able to make it a better place, and very grateful and thankful for the opportunity to be able to do that.
Well, we appreciate you so, so much. Thank you so much for taking time out of your busy, busy schedules to be here with us today and spend some time sharing. With that, we do have a few more minutes here. We can circle back on any other questions for the panel here or to any of the presenters. Anything that's come up for you over the last almost 2 hours here that we could get some questions answered. I know Joaquin and Nikki have also shared some wonderful resources in the chat, as well as their contact information, which we'll also send out afterwards if something is striking you down the line. And then just to reiterate, we know that there's a lot of questions around the CHW benefit, and that billing guide that's coming out should help answer some of those questions. And then we as Greater Health Now commit to continuing to bring you all information as it becomes available related to the benefit, and especially what that looks like specifically for anyone who's contracted with our organization, what elements we can support or provide, and then what it looks like to be a billing entity if you're contracted with Greater Health Now. So but any last questions before we jump off here?
Who will we speak to directly with your organization if we're interested in having a contract through you guys?
I'm going to volunteer Nicole as a good starting place, who's on this call. Nicole Matthews is our director of the Social Care Network.
Okay.
And Nicole, do you want to
I'll go ahead and
respond?
I'll place my email in the chat, and then you can reach out and we'll get you connected with our leadership and move forward, okay?
Thank you.
So I do have just a few last housekeeping items here. So as we shared, our next month's webinar will continue this dialogue around this CHW Medicaid benefit. We'll have individuals from the Healthcare Authority talking about enrolling as a Medicaid provider. What does that even look like? How do you do it? What are the steps that you take? And then we will commit to continuing the conversation around the billing guide as it becomes available. So please mark your calendars. You can register through the QR code on the screen if you'd like to get signed up for next month. Another great way to make sure that you're always receiving the Zoom links for these learning collabs is to make sure you're subscribed to our newsletter. So if you indicated that you were interested in getting our newsletter when you registered for this one, we'll go ahead and get you subscribed, and then you can watch for the Zoom link for next month's topic as well. And then one last ask that we have for you is if you could take a moment or two to fill out a quick survey that we have regarding the Learning Collaboratives. We'd just love to hear how your experience was and if there's anything we can do to improve. So again, another QR code for you here. And we'll send out the links for all of these as well in the follow-up email, which will be coming out in the next day or two. And that will have the resources provided from our presenters as well. So be on the lookout for that. And then there was a question in the chat about the recording. We do record these webinars, and it will be posted to our website. The timeline for that might be a little pushed out beyond the next few days. It should be shortly though, within the next week or two. So we will make sure the link for that is on that follow-up email when we send that out as well. All right,
Thank you, Danny.
Yes, yeah, I'll just leave you with my contact information if you need anything, or if you have any questions about the Learning Collaborative or need help getting in touch with presenters. But other than that, thank you all so much for being here. An incredibly huge thank you to our presenters. What a just information-packed 2 hours, just incredible. Thank you all for your time and energy. And then thank you to everyone for being a phenomenal and phenomenally engaged audience. I'm just so impressed by all your questions and engagement in the chat. So thank you all so much, and hopefully we'll see you next month.
Thank you, Danny.
Thank you.
Good one.